You may want to have a rhinoplasty for a number of different reasons. For some patients, it may be due to childhood trauma where they've had an injury to their nose. Alternatively, they may have had an injury later on in life which has changed their facial profile. For others, it may be simply due to breathing issues that they may require a rhinoplasty. For some patients, they may not be happy with the appearance of their nose in proportion to the rest of their face, so rhinoplasties can be carried out for lots of different reasons. When a patient comes in for the first consultation, typically they'll have some ideas as to what they would like to achieve, and they should communicate that clearly to their surgeon. The surgeon too will be able to say what is realistically achievable, so it's important to have that rapport with them. Most surgeons nowadays will have morphing software, whereby they'll be able to take photographs of patients before their surgery, edit them, adjust them as to what could be achievable. So it's an important means of communication between patients and surgeons. In terms of what is achievable, we have to bear in mind that we can only work with what we have already. For example, patients who have had previous nasal surgery may not have sufficient cartilage remaining, so they may need cartilage to be taken from either their ear or their rib. In patients with thicker skin, some of the changes that they wish to achieve may not be possible simply because those irregularities or changes would be hidden or masked by their skin. It can be undertaken through an open or a closed approach, and that means a little cut at the base of the nose in an open approach, or no visible cuts in a closed approach. Typically, you'll come in to surgery on the day of the operation, be fasted for 6 hours beforehand, and the procedure is carried out under general anaesthesia. When you wake up, you'll notice there'll be a plaster cast on the outside of the nose, some splints potentially on the inside, and some stitches at the base of the nose. But pain usually isn't too much of a problem. At about a week following the operation, I'll see you to take away the plaster and the internal splints. The stitches at the base typically dissolve by themselves. And then I'll follow you up for up to a year following the operation. After the surgery, you will also notice that your nose feels more blocked initially before it gets better. There'll be some swelling and bruising around the eyes and the cheeks, and the nose itself will look rather swollen, and this will continue to improve over the coming weeks and months, even up to 1 year following the operation. Ultimately, surgery to the nose, rhinoplasty surgery, can be tremendously transformative, both in terms of the quality of life from a breathing point of view, but also from their self-confidence perspective.